So as your MC today, I want to try and get us back on schedule. We've really have a packed agenda for you, so I'm going to keep my my own opening remarks relatively short. We have two other esteemed guests that are doing welcoming remarks as well. But what I will tell you is that in 2016, the three state universities through the Arizona Board of Regents established a tribal consultation policy, specifically around research. And in the process of putting this policy together, it was in collaboration with the 22 tribes, 21 by way of Intertribal Council of Arizona, and with the Navajo Nation, who's not a member of Intertribal Council. So it was fully vetted in terms of drafts that were, there was a working group, Intertribal Council of tribal leaders and their attorneys that looked at this consultation policy draft is ABOR 1-118. And we also got a resolution from Intertribal Council prior to presenting this to the Board of Regents for approval. And we also, there was somewhat of a deadline for us to want to get this done through the Board of Regents. Why Luann Leonard was a member of the Board of Regents, who is a member of the Hopi tribe. And so in the process of taking this before the Intertribal Council of Arizona at one of their regular meetings, they had a pretty good turnout, in not necessarily because they wanted to hear from us, but they had Indian Health Service, they had EPA was there to do a presentation, Arizona Department of Revenue was there, kind of challenging some taxation issues with tribes. And we were fourth on the agenda. And it was an uncomfortable meeting for those other agencies, as the tribal leaders really, were advocating, and pressing them on the lack of services or jurisdictional issues or other issues. And so, I was a little worried because we're the universities and we're up next, so we'll probably get chastised as well. But what we presented to them was this understanding that tribes need research too. Tribes need data collection. They need the analysis when they're dealing with entities like Indian Health Service or with EPA or Department of Revenue with the state, is that they need good data. And our tribes are sending students to our institutions, and they're supporting them in terms of their expectation that they get an education and they come back and they work within their own communities. And so part of that is an IRB process. We do have situations where our students have to change their thesis or extend their time because they're not able to get through their own tribe's IRB process. And it's become somewhat of a disadvantage in that the idea that they were pursuing this degree to do work specifically in their own community is, how can we build that bridge from both sides? How can we extend our IRB in a way that is reflective of the cultures and the ways of being within our own communities, that is sensitive to what is appropriate and what's not. And then also from the tribe side is, how can we help tribes build their own capacity in terms of their own understanding of research and IRB. So this event has grown out of that original commitment to the tribal leaders that we would continue to have this conversation on an annual basis. And over the years, it's evolved into really three stakeholders, primary stakeholders: community, researchers, and students that are on a research path, whether it's a PhD or pursuing other thoughts about how they anticipate, their academic and their future professional career. So again, we welcome you. And what we also learned over the many years is that you all are not interested in just talking heads. You want to interact, you want to contribute. We have, great experts within the audience. And so our purpose is to have folks kind of set the narrative in the morning on some of these topics, and then the breakout sessions are to further explore and gain your insight and your thought process on these topics that are within the agenda. So again, thank you, and thank you for joining us. So next I would like to introduce Sally. Oh wait, not Sally Martin, I'm going to Dean Hillitzer. Dean Deborah Hillitzer is the Dean of College of Health Solutions. And again, without both Knowledge Enterprise and College of Health Solutions, this type of event would be possible. So again, I want to thank Nate and your whole team. So Dean Hillitzer. Okay.
Good morning. Thank you, Jacob, for your remarks and for your leadership in organizing today's event in conjunction with ASU's Office of American Indian Initiatives and ASU's College of Health Solutions. I appreciate all that you do to grow healthy partnerships between ASU and tribal nations and Indigenous communities to ensure the success of American Indian students at ASU. And to Sally Morton, my colleague who will speak next, it's great to have you here representing ASU leadership and knowledge enterprise. Thank you for your ASU-wide efforts to drive research that is beneficial to, respectful of, and in collaboration with the communities that ASU is here to serve in Arizona. And thank you to everyone on the conference planning committees who has made today's event happen. So greetings from the College of Health Solutions. I'm very happy to be here with you today. Being trustworthy collaborators with tribal communities and being research partners in health and health equity are priorities for us as a college and for me as an individual. For the last 25 years, I have personally had the good fortune to collaborate with colleagues on more than 10 different Indigenous communities and to offer my expertise to help them to find solutions to the problems they identified. These experiences brought me the opportunity to learn about how a wide variety of health problems impacted Indigenous populations. When I lived in New Mexico, I collaborated with members of the Navajo Nation on various research related to agriculture, health, and safety. It's pretty amazing coming from New York City. For each project, we went before the Indian Health Service Institutional Review Boards, or we call them IRB, for the Navajo region to get approval to conduct the research. IRB community members always ask two questions. Who is on your team? And how will your project benefit us? I became so appreciative of the IRB's feedback, their insistence that local community members always be directly involved was really excellent because it helped us non-Navajos better understand the culture and develop collaborative approaches. These approaches were not only relevant, but integral to the research and better aligned to the community's needs. What I have learned from working in multiple Indigenous communities is that as university faculty, staff, and students, we cannot helicopter in as experts and try to solve a problem of our own choosing on our own. Instead, we must come together to listen to the wisdom, knowledge, ideas, and needs of community members and then work together towards goals they have identified and prioritized. That's why I'm so pleased that CHS is now co-hosting this annual conference. As a college, we have committed to strengthening our dedication to Indigenous health and health equity and have seen a progression of collaboration and consultation over the last 2 years. In 2020, we began hosting health talks, speakers on the impact of COVID-19 on racial and ethnic minorities. Subsequently, CHS was invited to develop and host the ASU Indigenous Health Summit in 2021 and to publish the summit findings, which led to a convening of a group of leaders we called Indigenous Health Ambassadors who advised us and mentored our students. In the summer of 2022, we hosted the health track of the Inspire summer program led by the Office of American Indian Initiatives, where high school students from tribal nations in Arizona learned about health and health professions. At our celebration of health in October, we awarded our first Outstanding Alumna Award to Danae Becks of Tumbleweed Nutrition, who also helped with the Inspire program. After increased involvement in this conference last year, officially co-hosting this year's conference was a natural next step. Back when I was working with the ranchers of the Navajo Nation, I did not have their knowledge of raising cattle, but I did have a lot of experience in grant writing, program planning, and evaluation. Together, we leveraged our expertise for a successful funding proposal to prevent agricultural injury. Similarly, I know that every person and community represented here today has unique experience to contribute. None of us are the experts on every topic, but as we contribute our knowledge in complementary ways, we will find great synergy to solve health problems. As a college, one way that we can contribute is by helping to provide infrastructure, such as today's conference, to bring together thought leaders. I'm excited to be part of this effort to share knowledge and build relationships. I'm looking forward to all that we'll learn today and the projects and ideas for action that will follow from these discussions. Let's have a fruitful and collaborative conference. Now I will hand it over to my colleague and friend, Sally Morton.
Good morning. Thank you, Jacob and Deborah. It's an honor to join you in welcoming everyone to this event. I'm thrilled to have the opportunity to attend this conference for the first time. I'm Sally Morton, and I'm Executive Vice President of Knowledge Enterprise at Arizona State University. Knowledge Enterprise is responsible for the research and economic development ecosystem of the university, and we have one overarching purpose: to change the way the world solves problems. The work we do supports thriving people, a thriving planet, and a thriving society. That includes solutions for human health and well-being, as well as healthy communities. The ASU Charter calls out the university's responsibility to advance research and discovery of public value. It also states that we assume fundamental responsibility for the economic, social, cultural, and overall health of the communities that we serve. Where there are problems in our communities, we want to partner to help address them. Now, I see a correlation between these university commitments and the guiding principles of research in Indigenous communities that have been identified in this conference in previous years. That research conducted in Indian country be impactful and beneficial for the community. That it acknowledges the community's beliefs and value systems, and that it is conducted with the proper protocol, collaboration, and methodology and respect. There's an opportunity to do more work with Indigenous communities, and that's the reason we're here today. At ASU, we are here to be a partner and a resource. This can be seen in some of the youth-inspired research projects that we're already conducting with tribal nations and communities, and I wanted to give you just a few examples. Dr. Crystal Tosi from the School of Life Sciences is on track to engage with Indigenous peoples to study genetic variations to improve precision and genomic medicine for tribal nations and communities, and in a way that also protects data sovereignty. Dr. Wendy Wolfersteig from the Southwest Interdisciplinary Research Center is collaborating with the Phoenix Indian Center to evaluate youth and adult prevention programs, including substance use and abuse prevention, college and career readiness programs, and youth and adult needs assessments around substance abuse and suicide. We are co-developing a research data engineering fellowship with the American Indian Higher Education Consortium that we plan to launch this summer with Tribal College and University TCU faculty. And in 2021, Dr. Flavio Marsiglia from the Global Center for Applied Health Research led efforts to identify and address barriers in access to COVID-19 related testing and wraparound services for the most marginalized communities across Arizona. Dr. Marsiglia and his team work closely with the Health and Human Services Department at the San Carlos Apache Tribe to develop culturally relevant public health education and promotion materials that were widely distributed. Now, despite these successes, we know that successful partnerships require ongoing collaboration. It requires listening to and learning from those in the communities where we are doing research and who we partner with. It requires understanding what their priorities and needs are, as Deborah said, and incorporating those understandings into how we engage and work toward mutual benefits. And that's why events like this one are so important, to come together to understand how we can successfully conduct research to improve health, wellness, and other positive outcomes in tribal nations and communities. Research in Indigenous communities means coordination, communication, and community involvement through all facets of the research process, from identification of the research question all the way to dissemination and communication. And today we'll hear perspectives from members of the community, researchers, students, and others. And I personally look forward to learning more about how we can build on our efforts thus far and create a successful, long-lasting partnership. So welcome, and I'm looking forward to an exciting day. Thank you.